Thank you, sir, for the wonderful explanation. That leads me to the third question of our questionnaire. We have always seen that many homeopaths take time to take the case, the whole history, and it is very accustomed. Every patient for this is like you have to take 1 hour or 1.5 hours. If you are taking appointments to the homeopath, they are telling you that bring all the reports and at least have some 2 hour or 3 hour gap that we will take that time. Do you think is it required? Is it necessary?
Sejal, again, I would answer your question with the help of organon. Read the paragraph 82 and the paragraph 99. Hahnemann has clearly mentioned case taking of an acute disease is comparatively easy. What he has written, I will tell you. He has mentioned the symptoms are striking, they are self-evident. You need fewer questions to elicit the information. Patients are more cooperative, more communicative because they have fresh memory of the symptoms in their mind. So you get the exciting cause, you get the sensation, you get the location, you get the modalities. It is comparatively easy to constitute acute totality to find out the acute remedy. In these 2 paragraphs, Hahnemann has said case taking of chronic disease is comparatively difficult. Why it is difficult? Because he has forgotten the original symptoms. He is frustrated, he is depressed, he is convinced that there are no remedies which can help him. Moreover, original symptoms have been suppressed by suppressive allopathic drugs, and that is the reason in chronic a longer time is required in comparison to the acute. But let me tell you very honestly, as far as my organon teaching goes, nowhere in the entire organon Hahnemann has mentioned time dimension. Nowhere. Nowhere he has written 1 hour is required or 3 hours are required. What is required is longer time. So, time specification is not made. Let me tell you very honestly, you might take the history of a chronic disease for 3 years, but you may not get the remedy. But you might be taking the history only for 30 minutes, maybe 10 minutes, and you get the prescription. It all depends upon how proficient you are, how capable you are, how experienced you are. It all depends upon your own observations. So it's not the time dimension that decides.
It is actually, your answer reminds me when your lecture, when I was attending and you told that a physician must be efficient and proficient. Yes, so this answers very well. Thank you, sir.